Hi, I'm Dr Carl Shakespeare, and I'm a consultant cardiologist here in London. I'm also a physician too. I'd like to talk to you today about fatty liver disease, as it is a condition that's attracting a lot of attention and with it a certain amount of anxiety and worry. So this is an opportunity to try and discuss it. It is on the whole a silent condition with very few symptoms, although people can describe fatigue, weight loss, even abdominal pain, but they are rather vague and non-specific. But more usually, it's picked up incidentally when a doctor has requested an ultrasound of the abdomen for another reason, or if blood tests are performed, an abnormal liver function is described. There are essentially two types of fatty liver disease, non-alcohol and alcohol-related. The distinction is a bit vague, but on the whole, women who consume less than 2 units of alcohol and men who consume 3 units of alcohol or less are deemed non-alcohol fatty liver. Well, what is this condition? Well, essentially, it's a metabolic syndrome where there is abnormal fat accumulation. And it overlaps with other sort of metabolic syndromes such as diabetes, obesity, reduced thyroid activity. The risk factors for getting this condition include being overweight, drinking too much alcohol, being diabetic or pre-diabetic, having low thyroid activity, having a raised cholesterol, or being a smoker. What characterizes this condition is abnormal fat deposition inside liver cells themselves. And as a result of accumulation with each cell, there is toxicity within the cells that results in inflammation and then damage. Damage within the liver and the rest of the body. It's highlighted by 4 distinct phases. Steatosis is the first phase, and this is potentially reversible. But about 20% of patients then progress to steatohepatitis, where there is more inflammation identified. The third phase is highlighted by fibrosis or scar tissue within the liver. And finally, the 4th stage is when there is cirrhosis. Well, what is the value of treating this condition? Well, as you might expect, potentially to prevent the onset of cirrhosis and damage to the liver. Secondly, it is potentially reversible, and most interest to a cardiologist, it helps identify other cardiovascular risk factors such as diabetes, high blood pressure, and raised cholesterol. In addition, it is an opportunity to treat those risk factors to prevent further complications that may affect the heart. Well, what is the treatment? Firstly, lose weight. Secondly, reduce alcohol consumption if it's an issue. Look for other cardiovascular risk factors, especially diabetes and raised cholesterol, and to modify all existing cardiovascular risk factors themselves. So if a patient is a smoker, it's an opportunity to get them to stop. If someone is pre-diabetic, potentially to lower the sugars from weight loss. Now, in particular, if there is borderline cholesterol elevation, statins will help reduce the cholesterol and in addition, potentially reduce the amount of liver fat inflammation. And more recently, aspirin has been shown to reduce the risk of liver cancer as a complication. Well, I hope you found this talk helpful. Thanks.